Hello everyone, my name is Pablo Pasqualotti. I am a chiropractor here in Brazil, and I also have a master's degree in human aging from the University of Passo Fundo. I want to say that it's a pleasure to be part of this incredible event. I was very happy with the invitation and for being able to share some of the researches that we are doing here. I'm going to start the lecture by talking about the importance of bringing research carried out in university closer to the real needs of society. I realized that one of the most problems that we face is to producing too much content that has no real use. Research that we keep it and shelve it and no one will use. So in addition to be a researcher, I am the owner of integrated health clinic. I am also a member of a course school, online course school for students and healthcare professionals. The purpose of the online course school is to go beyond theory and into the field of evidence-based and results-based practice. In fact, I am recording this lecture in our studio right now. So, to continue my lecture, I will use the help of my smartphone, and I apologize for my English, but I'm doing my best, okay? So, the title of our research is Effects of Manipulative Therapy and Interactive Training Games in the Perception of Chronic Pain in Peripheral Biomechanic Marks in Elderly People. Very interesting. So this work aimed to analyze the population of elderly participants in social groups to understand who these people are, their needs, advantages and shortcomings. The object was to verify the effects of manipulative therapy and interactive training games in the perception of chronic pain in elderly peripheral biomechanics markers. These biomechanical markers, we used oxidative markers, okay? We call oxidative stress. The study was a randomized clinical type, and the population consists of adults and elderly participants in social groups of the Coordination of Elderly Care of Passo Fundo. The population is composed of 815 adults and the elderly. The participants answer a questionnaire with 31 questions containing social demographic variables, use of medication, pain perception, nutritional status, and use of technologies. So, the reactive oxygen species, ROS, have been suggested as possible mediators of chronic pain and neuropathic pain. Some neuromusculoskeletal disorders affect neurofunction through the release of pro-oxidative substance, with great chances of pain chronicity. This sample consists of 27 elderly people who were randomly divided into 3 groups: a control group that received no intervention, group 2 received joint manipulation once a week over 14 weeks, and group 3 held interactive training games twice a week and received joint manipulation too once a week. Both interventions at 14 weeks. For the analysis was used ANOVA, Wilcoxon test, and students' t-test. The significance level used in the test was P is less than equal 0.05. Group 1 showed no significant difference in any parameter evaluated. Group 2 decreased perception of pain, P is equal 0.027, very nice. And the levels of T-bars, oxidative stress, was P is equal to 0.019. Group 3 showed reduced perception of pain too, like group 2. P is equal than 0.016. But no difference in markers of oxidative stress in group 3, just group 2. This analysis you can see in this presentation here. So, according to the results, it is concluded that the treatment of muscular pain by manual therapy causes reduction in oxidative stress levels and analgesia. Manual therapy, when associated with physical activity performance by gaming, reduces pain, but not the levels of oxidative stress. So these results were present for the elderly people who participate in this study. It is the duty of every researcher to return the acquired knowledge to society. During the survey, our group insisted on giving awareness-raising lectures to all 850 participants who responded to the questionnaire. This knowledge that I showed to you by this presentation is applied every day by me in my clinic, and I try to pass it on to as many healthcare professionals and students as possible, because I think it's important to give back to society, to share this knowledge, and to pass to other people, other researchers, to my colleagues, to healthcare professionals, to students. We need to share the knowledge, and we need to approximate the knowledge in university with the practice in our days. So I hope you understand my lecture, and I hope you like the lecture and the knowledge that I shared with you. And one more time, I'm very happy to be here and to participate of this incredible and amazing event, and it's a huge success, and thank you, and congratulations to you too. So I will leave my social medias, my social networks, and my contact to you. So if you want to call me, it will be a pleasure to answer all the doubts, the questions, and to change some knowledge and share knowledge. Thank you one more time.